second lecture. This is the types of breathing exercises, the continuation of the ventilatory training. This is Dr. Deepti Warikoo, Department of Physiotherapy, Dolphin PG Institute of Biomedical and Natural Sciences. So, first exercise we'll be dealing is a diaphragmatic breathing. It is the controlled breathing technique which emphasizes diaphragmatic exercises. Here, these techniques are designed to improve the efficiency of ventilation, decrease the work of breathing, increase the excursion of diaphragm, and improve gas exchange and oxygenation. In these exercises, we are mainly focusing on the strength of the diaphragm muscle. Diaphragmatic breathing exercises also are used during postural drainage to mobilize lung secretions. Now, how it is done? First of all, prepare the patient in a relaxed and comfortable position. What we mainly do is semi Fowler's position, but we can do it in lying or sitting also. If your examination reveal that the patient initiates the breathing pattern with accessory muscles, then start instructing to teach the patient how to relax those accessory muscles. Place your hand on the rectus abdominis just below the anterior costal margin. Ask the patient to breathe in slowly and deeply through the nose. Have the patient keep the shoulders relaxed and upper chest quiet, following the diaphragm to rise slightly. Then tell the patient to relax and exhale slowly through the mouth. Have the patient practice this 3 or 4 times and then rest. Do not allow patient to hyperventilate. If the patient is having difficulty using the diaphragm during inspiration, then tell him to inhale several times in succession through the nose by using a sniff like so he may able to concentrate on the diaphragm. This is the technique where the patient is in long sitting position. We are keeping our hand to focus on diaphragmatic breathing. Now, to learn how to self monitor this sequence, have the patient place his or her own hand below the anterior costal margin. He can feel the rising and lowering of the abdomen. The patient hands should rise and lower. After the patient understands, he can control the breathing using a diaphragmatic pattern. Now, next technique is the segmental breathing. These techniques are taught to expand localized areas of lungs while we keep the other areas quiet. We have mainly the two techniques which we will focus here, the lateral costal expansion and a posterior basal expansion. The lateral costal expansion, sometimes also called as lateral basal expansion, can be carried out unilaterally or bilaterally. You have to ask the patient to breathe out and feel the rib cage move downwards and inwards while you keep your hands on the lower margin of the rib cage. As the patient breathes out, place pressure into the ribs with the palms of your hand. Just prior to next inspiration, apply a quick downward and inward stretch to the chest. Apply light manual resistance to the lowering rib. This increases the sensory awareness as the patient breathes in deeply and the chest gets expanded. Then, as the patient breathes out, assist by gentle squeezing the rib cage in a downward and inward direction. You can teach the patient how to perform the maneuver himself by hands or by towel or some belt, etc. You can see this in these diagrams, the patient's performing the breathing pattern. Next is the posterior basal expansion. Here, first patient do deep breathing. Deep breathing emphasizes posterior basal expansion, mainly for the post-surgical patients who are confined to bed. Have the patient sit and lean forward onto pillow so that slightly there is bending of the hips. Place your hands over the posterior aspect of the lower lip and follow the same procedure what we did in the previous exercises. This is the self-assisted breathing. The next technique is pursed lip breathing. Pursed lip breathing is a strategic technique that involves lightly pursing the lips together during controlled exhalation. We have to maintain few precautions. The use of forceful expiration must be avoided because it can increase the turbulence in the air and further restrict the small bronchioles. Therefore, we have to elicit to teach the proper breathing strategy to the patient before starting a pursed lip breathing. So, have the patient assume a comfortable position, relax as much as possible, Have the patient breathe in slowly and breathe through the nose, and then breathe out gently through your lightly pursed lips as if blowing on air, like, and bending the flame of a, like you are bending the flame of a candle, or you are blowing out like that. Now, controlled breathing techniques. It is helpful to teach a patient how to monitor his or her level of shortness of breath and to prevent episodes of dyspnea. These can be done by controlled breathing techniques, pacing activities, and becoming aware of what activity or situation precipitates a shortness of breath or attack. So, patient has to be very peculiar about it. Now, what are the procedures? Have the patient assume a relaxed forward bend posture. A forward bend posture actually stimulates your diaphragmatic breathing. You can use bronchodilators as prescribed. Have the patient gain control of his or her breathing and reduce respiratory rate by using pursed lip breathing during expiration. Have the patient focus on expiratory phase of breathing while being sure to avoid forceful expiration. This technique is very helpful if the patient is feeling dyspneic or is having dyspnea. After each pursed lip expiration, teach the patient to use diaphragmatic breathing. Very important. We have to minimize the use of accessory muscle during every inspiration. Have the patient remain in forward bend posture and continue to breathe in a slow, controlled manner until the episodes of dyspnea subsides. Whenever any patient feels dyspneic, you have to teach them this technique. This is the manner how we can do it. Next are the positive expiratory pressure breathing. Positive expiratory pressure breathing is a technique in which resistance to airflow is applied during exhalation, similar to what occurs during pursed lip breathing, except that the patient breathes through a special designed mouthpiece or mask that controls the resistance to airflow. Now, this type of breathing is performed in an upright position. Preferably, patient can be seated with elbows resting on table. A low pressure technique involves tidal inspiration and active but not forced expiration through a mouthpiece or mask. The patient inhales, holds the inspiration for 2 to 3 seconds, and then exhales, and repeats the sequence and the cycle approximately 10 to 15 cycles. The patient removes the mouthpiece, takes several huffs, and then coughs. This cough clears the airways. The secretions are mobilized. The breathing sequence typically is repeated 4 to 6 times, with the total treatment session lasting about 15 minutes. Next is the respiratory resistance training. The process of improving the strength or endurance of the muscles of ventilation is also known as respiratory resistance training. It is mainly focusing the ventilatory muscles. So we also call it as ventilatory muscle training, or inspiratory muscle training, or inspiratory resistance training, or flow controlled endurance. These are the names we can give this training. It is to advocate to improve the ventilation in patients with pulmonary dysfunction. This dysfunction is mainly associated with weakness, atrophy, or insufficiency of the muscles of inspiration, or insufficiency for proper cough mechanism, or weakness of the abdominals or other expiratory muscles. We have to make sure that precautions are properly followed, avoid prolonged periods of any form of resistance training for inspiratory muscles. Unlike muscles of the extremities, the diaphragm cannot totally rest to recover from a session of resistance exercise. So you cannot give a lag time to diaphragm because you have to keep on breathing. So first technique in it is the inspiratory resistance training. Inspiratory resistance training is when using pressure or flow based devices to provide resistance to airflow. It is designed to improve the strength and endurance of all the inspiratory muscles and decrease the occurrence of inspiratory muscle fatigue, which is very important in breathing patterns. So the patient inhales through a resistive training device which is placed in his mouth. These devices are narrow tubes of varying diameter or a mouthpiece with an adapter with an adjustable aperture that provides resistance to the airflow during inspiration and therefore places resistance on inspiratory muscles. The smaller the diameter of the aperture, faster the rate of airflow, greater will be the resistance. The patient inhales through the device like several times. The time is gradually increased to 20 to 30 minutes at each training session to increase the inspiratory muscle endurance. Now, second is the incentive respiratory spirometry. Incentive respiratory spirometry is a form of ventilatory training that mainly emphasizes sustained maximum inspirations. The purpose of incentive spirometry is to increase the volume of air that we inspire. It is mainly used primarily to prevent alveolar collapse and atelectasis in post-operative patients. So, how we perform the technique? Have the patient assume a comfortable position. What all positions we are following till now can be used. Inhale and exhale 3 to 4 times and then exhale maximally with the fourth breath. Then have the patient place the spirometry in the mouth. Inhale maximally through the mouthpiece to the target setting and hold the inspiration for several seconds. That is what we are doing here, holding the inspiration. This sequence is repeated 5 to 10 times, several times per day. The patient inhales as deeply as he could. Handheld spirometer that provides visual or auditory feedback about whether a target of maximum inspiration was reached or not helps the patient. Then this breathing technique is performed while using a spirometry, but it may also be performed without the equipment while performing the inspiration, hold it, and expiration technique. The last technique is the glossopharyngeal breathing. It is a means of increasing the inspiratory capacity when there is a severe weakness of the muscles of inspiration. Glossopharyngeal breathing combined with the inspiratory action of neck musculature can reduce the ventilatory efforts. It can also be used to improve the force of a cough by increasing the volume of the voice or dependence. So, how we do it? Procedure of glossopharyngeal breathing involves the patient takes several gulps of air. Usually we tell the patient take 6 to 10 gulps in series, one after one, one after one. So these gulps are taken in to pull air into the lungs when the action of the inspiratory muscle is inadequate. After the patient takes several gulps of air, the patient is asked to close the mouth, and then the tongue pushes the air back and traps it in the pharynx. The air is then forced into the lungs when the glottis is opened. This increases the depth of inspiration, and the patient's inspiratory and vital capacities also are affected. So these were the breathing exercises, the different types, how they are performed. I hope you understood it. If there are any queries or questions, they are all welcome. In next section, we will be dealing with the other respiratory techniques used like postural drainage, coughing, vibration, shaking. Thank you for today. Have a great day.